A new study shows that ivermectin, yeah, that bullshit didn't work. You know, you had Donald Trump and all these other people out here yelling, hollering, screaming, Joe Rogan and others saying, oh, we should have everybody taking ivermectin. Well, they found it to be ineffective in decreasing the chance of hospitalization for patients with COVID. The drug, typically used for parasites, was promoted by conservative commentators and Fox News as a treatment despite a lack of conclusive evidence early in the pandemic. Well, researchers with the New England Journal of Medicine says they did not find a significantly or clinically meaningful lower risk of medical admission to a hospital or prolonged emergency department observation. Ivermectin is not authorized or approved by the FDA for use against COVID, and most health experts recommend against prescribing the anti-parasite drug for this purpose. Dr. Alexa Gaffney, an infectious disease specialist, joins us now. Well, hello.
Hey,
as they say, as we say on here, hashtag, we tried to tell you.
Yes, we sure did. And it's like beating a dead horse. People will not.
No pun intended. Hold on. Beating a dead horse, no pun intended.
None. No pun intended. So over the course of this pandemic, since this whole notion that ivermectin could be helpful against COVID-19, there's been tons of quote unquote clinical trials. And I'm throwing air quotes because when they tried to do a meta-analysis of all of this data, they had to throw out a significant portion of these studies because they just weren't done properly. You know, the gold standard of a clinical study is a double-blind, randomized, placebo-controlled trial. And most of the people who are out here supporting ivermectin don't even know what that means. So when they looked at data, they found that, yes, there was no statistically significant difference in outcomes in people who received ivermectin early in the course of their COVID-19 infection, looking to see did these individuals end up being hospitalized or did they have to have prolonged emergency room evaluation. And the reason for the prolonged emergency room evaluation was because they looked at this data at a time where COVID was so rampant. Many of these hospitals did not have room to admit these people. So a prolonged ER evaluation or observation meant that you would have been hospitalized if there was room at the inn. So there was no clinically significant benefit of being on being on ivermectin for a COVID-19 infection. So we need to let this go.
And also, just want to get your thoughts real quick on that other study that showed that once white folks found out that COVID was hurting us and brown people, they gave less of a damn.
Yeah. And that's been my argument all along in talking to our people, talking to Black people. You know, we have to remind ourselves, we have to remember that we are living in Black bodies and we were more significantly, more negatively impacted by COVID-19 than our white counterparts for a number of reasons. Inability to work from home, access to health care, different levels of health insurance or lack of insurance. Did our hospitals have clinical trial medications available? Did our hospitals have resources available? And so even though men were more likely to die from COVID-19 infection, Black women were 4 times more likely to die from COVID than white men. And so, yes, people are over it and they have the luxury of being over it because, God forbid, if they wind up being hospitalized, somebody is going to fight for their lives much harder than they're going to fight for our lives. So we cannot be in a position where we are behaving like the privileged people. We do not have the privilege. We don't have the same access and we don't have the same outcomes. And we have to be incredibly mindful of that.
All right, then. Well, Dr. Gaffney, last question for you. What about, I'm seeing these reports. I was just seeing a text message a little bit earlier, an alert from the Wall Street Journal about more outbreaks happening in other parts of the world for a new strain of COVID. What should we be concerned about? In fact, the Wall Street Journal said deaths at a Shanghai hospital battling a COVID outbreak suggests infections are hitting the city harder than officials have disclosed. What should we be concerned about?
Yeah, so there's a BA.2 or BA2 variant of COVID-19. It's an Omicron subvariant, and they're seeing it in areas of China, Hong Kong, and of course over in Europe. And remember, previously in the pandemic, what we experienced in terms of surges or big outbreaks of COVID followed about 3 or 4 weeks behind what was going on in Europe or Italy at any given time, and a month or so behind what was happening in Asia. So their COVID-19 activity is predictive of what is to follow here in the United States. And we've seen an uptick in cases due to the BA.2 variant. So over the course of 2 weeks or 3 weeks, we had no BA.2 being reported. And then it was about 13% of cases of COVID-19 were due to this variant. And now it's upwards of 24% of COVID-19 cases. We do have pockets of the country that are well vaccinated or maybe have a lot of natural immunity, and other pockets of the country that don't. But we have to remember that nationwide vaccination for Black people is only about 8%. So we can't go based on the numbers that are representative of the whole country. We have to look at what is going on in our own communities in order to understand, do we have any sort of protective bubble around us because people have COVID immunity? And I would say in Black communities, probably not.
All right. Dr. Alexa Gaffney, we appreciate it. Thanks a lot.
My pleasure. Have a good night.
All right, folks, back to our Roland Martin Unfiltered video in just one moment. Hey, folks, welcome back. Patrol Grooming, of course, is a men's grooming company that delivers on this promise every day to men everywhere. Everything we do, every product we make is designed to help you to present your best self. Now, y'all see me. I'm sitting here wearing a suit today, but clean shaven. This is the video from this morning as I was using Patrol Grooming's products. You can actually see it right there. Folks, it's a promise they have kept since 1991 when they first introduced the Bump Control brand, the #1 men's product for smooth, bump-free, shave, and silky skin. Millions of customers count on their exceptional skincare products, which can be found at more than 30,000 retail stores in more than 50 countries around the world. Now you can have exceptional beard and skincare products that are as unique as you are. Brothers, as we prepare to head back out into the world as COVID restrictions are being lifted, it's time to be smooth and clean. Y'all know how we do. That shaggy look, it got to go. Visit www.patrolgrooming.com to order a Patrol Grooming box and use this discount code, #Roland30, #ROLAND30 for a 30% discount at checkout. And we certainly appreciate Patrol Grooming being a partner with us here at Roland Martin Unfiltered on the Black Star Network. Folks, Black Star Network is here.
I'm real revolutionary right now.
Support this man, Black Media. He makes sure that our stories are told.
Thank you for being the voice of Black America, Roland.
Stay black. I love y'all.
All momentum we have now, we have to keep this going.
The video looks phenomenal.
See, there's a difference between Black Star Network and Black-owned media and something like CNN.
You can't be Black-owned media and be scared.
It's time to be smart.
Bring your eyeballs home.
You dig?